Hi, this is Dr. Dan Marin again. I wanted to just bring you into our clinic and show you some of the things that we like to evaluate with our patients and go through. We like to look at kind of the whole biomechanical model with our patients and address how they got into their trouble to begin with, and knowing that, then we can show them how to get out of that and also to stay out of our office. One of my favorite sayings is that I'd like to see you in the grocery store and not see you in my clinic, since that means that we've done our good job of getting you better and then getting you stronger and keeping you out of trouble. One of those things that we see a lot of in today's day and age is really, we'll just call it poor posture. We have a lot of influences today that are really not doing good things for our spine, and those are our cell phones and driving and worrying and sitting at computers, and it really puts us in a forward flexed position way too much. And I often get patients who've been bank tellers or administrators at desks, and they've been sitting for 8 hours, 9 hours a day for 20 years, and they come in and they ask me, well, why does my back on my MRI show all these discs that have been worn and beaten up? And I tell them, well, let's think about what you've been doing for the last 20 years. And so one of the key fundamentals in starting to address this is about knowing what is your neutral position. And so I go through this with a lot of my patients, especially my back patients. And so it's as close as a flat wall that you can find this out. And so if you put your heels against a wall and then your butt and your shoulder blades and the tip and then the back of your head, or what we call the occiput, okay, and then your chest is up and your rear end is touching, and you allow your arms to roll to the side, this is neutral spine position for everybody. Everybody has a neutral spine position. And one of the things that we lose sight of is that we are not stick people. We were not designed in completely linear bones. We have curves, and the reason why we were designed the way we were was to distribute our load through our spine appropriately. And so we have a curve to the back in our low back, we have a little curve to the front in our chest area, and then a curve to the back again in our neck area. So it's really important that when we're at work or driving and we have these issues, that we're paying attention to whether or not we're balanced, because everything in life is a balance. So if you put yourself in this position, you're pretty much going to find out, how can I keep this, because it doesn't feel normal to me. And it doesn't feel normal because we've been sitting in chairs and worrying about our tests and studying and working at computers all the time, so that we've stretched out some of the muscles in our back. Well, good rehab and getting out of these problems means that we have to develop these muscles back again. And so we're not going to be able to know that if we're not working on it. So pretty much, if you think about where the back of your ear sits, and when I'm in neutral position, spine position, you're going to find that that back of my ear is going to sit pretty much right over my shoulder. So if you think, where's my head, where's my ear sitting, then that'll give you a good reminder of where you're supposed to be. And so then you need to find your workstation at your work desk. And so when you're sitting at your desk, you want to take that same position again. And so you're going to be sitting, and your ear should again sit over your shoulder, and then you're going to be at your computer station. And your computer monitor needs to be in front of your eyes so you're not falling forward and starting to put pressure on your low back again. So that's just one little nugget about how we try to treat the whole patient and try to fix the problem, working on the origin of the issue, and try to address through education how patients should start thinking not only at their workspace, but also in their cars and also standing upright, about how they're activating their muscles in their back to get themselves better. The more activation, the stronger the muscle will be. The less activation, the more flabby. And so what we want to do is really work those muscles daily and then keep us out of trouble. So that's just another little tidbit from us that we can provide for you, and what we provide for our patients to try to get them better every day.